Welcome to a Shot in the Arm podcast. I'm your host, Ben Plumley. This is a podcast about global health and human rights. We explore global health challenges, particularly infectious disease, and how societies adapt, make sense, and respond to them. Whether it's with new biomedical vaccines, treatments, and prevention technologies, or whether it's with good old-fashioned changes in behaviour, very relevant for the current moment. And for those of you who connect with us by video, you'll notice I've shaved my beard, if not my moustache, so I can wear a face mask while out and about. Well, I'm thrilled to announce that a Shot in the Arm podcast is partnering up with the Bay Area Global Health Alliance to bring you a special series, beginning with this episode, that breaks down the latest COVID-19 news and developments. For the next few weeks, we will meet a range of global experts and take you behind the scenes of big decisions with leaders at the forefront of the global response to COVID-19 and global health security. And we'll do this through a unique Bay Area lens that blends tech, biopharmaceutical, and academic and non-profit expertise. We will be looking at how we were all in this together, looking at the intersections of human health, our environment, and the connectedness of what happens here at home and across the globe. So a few words about the Bay Area Global Health Alliance. It was formed to connect and mobilize the unique talent pool and diverse expertise associated with the Bay Area to maximize the region's impact on global health. Its members are world-class academic institutions, innovative technology and biotech companies, and non-profits. It connects scientists, experts, and sectors across the Bay to catalyze innovation and equity in global health. Imagine organizations like the University of California in Berkeley, Davis, San Francisco, Stanford University, Chevron, Facebook, Gilead, Global Impact Advisors, Google, LEK, Public Health Institute, Merck for Mothers, PATH, and Ending Pandemics, to name just a few, all in a room, or I suppose now in a chat room given our new reality, exploring how we harness our expertise to address challenging global health issues of our times. Now, she's going to kill me for saying this, but the Alliance recently appointed a new executive director, the fantastic Sarah Anderson, who's an incredible leading advocate in global security and development. And she's already making her mark in driving collaborations between the Alliance members and local community. For more information about Sarah and the Bay Area Global Health Alliance, visit its website, www.bayareahealth.org, for more information, or connect with them on Facebook and Twitter. And the other thing to say about the Alliance is that in a very real sense, it's a fascinating slice of the global who's who. Mary Pittman, Michelle Barry, Colin Boyle, Steph Bertozzi, Anand Reddy, Jonathan Kafuri, Purnima Mane. It has an incredible intellectual capital. And it's another of those founding members, Jonna Mazet, that we're going to meet in this episode. Dr. Jonna Mazet is Professor of Epidemiology and Disease Ecology, and she's Executive Director of the One Health Institute at the University of California, Davis. She is a member of the National Academy of Medicine. She is a leader in global health problem solving, especially for emerging infectious disease and conservation challenges. And she is a leading international researcher in disease transmission among wildlife, domestic animals, people, and the ecological drivers of disease emergence. Jonna, welcome to a Shot in the Arm podcast.
Thanks so much for having me.
Oh, it's really terrific that you can join us now. About, I suppose, a month and a half ago, you and I were on plastic boxes in a crowded bar in Market Street talking about COVID-19 and misinformation. Oh my gosh, what a different world. A month and a half later, did you expect it to be like this?
No, I mean, I'm much more comfortable here, but I feel for all the people who are not in such comfortable quarters.
So you're a board member of the Bay Area Global Health Alliance. What are your hopes and dreams for the Alliance? What can we do? Our theme is all in this together, particularly for COVID-19. But what do you think we can do over the next coming months?
Well, I think my hopes and dreams for the Bay Area Global Health Alliance have changed dramatically since I joined, and I've been a supporter for quite some time. But for COVID-19. I think it really is our clarion call, and we need to be a force for good, and we need to make sure nothing like this ever happens again. And that is within our means. We can do that. We can do that together, and really, it includes bringing science to the trusted place that it used to be, and then using it, frankly, to be prepared.
So you have a career in pandemics preparation. The collision of human population growth, the intrusion onto wildlife, the and the impact of climate. So in a sense, we've been seeing that something like this is coming, but have we been taken by surprise? What have we got wrong here?
hmm Well, a couple things. And I'll tell you, I like to come from a hopeful place because I think we need to do something better. And I think the silver lining in this horrible tragedy is that the world is listening, and this virus is terrible, but it's not as deadly as it could be, or the next one might be. So really what we need to do is we need to understand viruses more fully, similar to what centuries of studying bacteria has done for us. We really need to do that for viruses. And of course, I work on the far upstream side, trying to find the hosts of these viruses and all of the transmission interfaces or the circumstances in which spillover happens, so that we can identify those, address our behavior around those, and then be ready to detect spillovers even if we can't change our behavior.
Now, you are part of, and indeed you lead the Predict program at UC Davis, which, congratulations, has just got a formal extension. We're really thrilled about that.
Thank you.
And you were at the forefront of detecting SARS-CoV-2, the virus that causes COVID-19, and you helped discover that, I guess, in the first patients outside of China. And you've got...
Not me personally, actually. Let me just say, the Predict teams in all of the countries where we were working did end in September 2019. Their funding ended and the project ended. And the amazing scientists in the laboratory that was the partner laboratory of Predict, the Wuhan Institute for Virology, did find this virus and did detect it at the very beginning. And then our other wonderful teams around China in other countries used the Predict platform to detect SARS-CoV-2 before we called it SARS-CoV-2 and before we had a full sequence, using the Predict platform in places like Nepal and Thailand and others. So certainly that happened, but they were volunteering. They came back to support, just like we're talking about with the Bay Area Global Health Alliance. They were coming back voluntarily to support their countries. Now we are in an extension phase that has some funding, and we're really thrilled to be able to support all of those countries to continue to do this assistance using now the better test because we have the sequence.
And yeah, that's an absolutely important clarification. Again, all in this together. One of the things, if I've got it right, that you're going to be looking at is what happens in Africa and the Middle East. And I wondered if I could just pick your brain about Africa for a moment. I mean, for those of us who've spent our careers trying to help strengthen the health infrastructure in sub-Saharan Africa particularly, we're a little worried. How do you see this playing out? And will we see a sort of a next wave hitting Africa in the sort of June, July time?
Well, it's hitting now, but it's early days. And again, I'm thrilled to be able to say that our Predict scientists in Africa, we're at the cutting edge of looking for these viruses, especially coronaviruses. Some of our Predict scientists in their countries are the only people that ever had a publication, for example, on a coronavirus, or only people that were trained to do molecular virology for emerging threats from wildlife. So we're seeing those scientists that worked on PREDICT being on their national task forces. And I believe partly because of that, they are really being much more proactive in some of those countries, especially than we were here. And so they are already social distancing to the extent possible, sheltering in place. I'm on Zoom with people in those countries every day. We've already done Echo platform that had people from 50 countries participating to try and talk about what's known so far. And now we're going to do another one really soon, next week or the week after, to start to talk about community surveillance and contact tracing. So I think actually they're being more proactive and better prepared, partly because they had a little bit more time, but they are seeing introduced cases, and they're being really prudent and careful about that.
And from the community mobilization side, we see incredible advocacy and getting accurate information out, which we could really benefit from here.
Yeah, and getting ready to test.
Yeah,
and
exactly.
being able to test. I mean, that was really our downfall here. Is not having systems that were resilient and responsive to the unknown. And that is what we don't need to have happen ever again. We can have our systems set up to be able to have emergency surge capacity and pull in experts. We are rich with experts, but we need a way to bring them in.
Yeah, absolutely. One of the things that at this crowded bar session for the Bay Area Global Health Alliance at the start of a DevEx conference, one of the things that you, KX, and I were talking about was the need to get accurate information out and tackle misinformation. And you had just been a leading signatory of a letter that had I think gone to the Lancet, gone to the medical press,
Correct.
really emphasizing the importance that this was a natural virus, that there was no conspiracy theory here. Correct. Can you talk a bit about that?
Yeah, absolutely. I think whenever something scary and shocking comes, people want to find, it's human nature. We want to find someone to blame. And that's unfortunately the human condition. And there are things to blame. We're traveling heavily on this earth. We're treading too hard on our planet. There are a lot more humans than there ever have been, or that I bet your grandparents and mine would have ever expected there would be. And we're pushing into environments. We're using our environments differently. We're taxing our trade systems, and that has an effect on global health security, biosecurity. So it makes sense to me that people wanted to jump to that concern. Certainly, I don't think anyone in China, even if we take the science out of it, would want to do anything to their own people. But I did start to get, Twitter trolls and others, criticizing that actually this thing was made in a US lab. And, everybody wants someone to blame. In this case, we can blame humanity for not being more gentle or caring as much about how we impact the earth. That has all kinds of implications for climate and everything else. But nobody made this virus. It evolved along with its hosts, almost certainly bats, and then it spilled over. And it will be some time before we fully understand. We can track that spillover, but all the scientists that work on this need to be helping with the human-to-human spread right now. So it will be some time before we really get a handle on how that spillover occurred.
And I think, part of the problem is we have to accept that very often when people ask us questions about COVID-19 and the spread of it, the answer is, I don't know. And this can be a challenge. You and I have worked on complex infectious diseases all of our lives, where medical science, Western medical science, hasn't necessarily immediately had those answers. So maybe we're more prepared for it. But what do
Yeah.
we say to a community, to a society that is used to having doctors having the answers? And
Mhm.
how do we build trust and communication in an environment where we just have to say, look, guys, we don't know yet?
Well, getting the right information out and being honest, I think we have to acknowledge their frustration, our frustration. And frankly, I've been talking with their physicians as well, because and people again start to blame their physicians who are doing the absolute best they can. They are the heroes in this
Mm.
situation. They're putting themselves and their families at risk in a situation where they have very little certainty. So the more science we can do, the better to help support them, and they have to implement the guidelines that they're given. We need to be working on those guidelines and making them stronger, which is why I'm very pleased. Just over 3 weeks ago, I was asked to join a new standing committee of the National Academies to really consult on COVID, but not just COVID, to be ready for the next one. So I think that was forward thinking of the academies in response to the White House saying, let's bring in the scientists, maybe a little late, but better late than never. They had great scientists in the agencies, but I think it's really important to bring in groups like we represent through the Bay Area Global Health Alliance, bring in the academics. Nobody, can be an expert in everything. And so we need to bring in the people that study these things when these tragedies occur.
And it sort of points out something to me, which I guess has been on show really since the start of the year, a sort of, how shall I put this, Anglo-American hubris that we don't need to bother, that, we won't be affected, that our public health systems are okay and we can handle anything that's thrown at them. Again, one of the things I love about the Bay Area Global Health Alliance is that it brings in nonprofits, not only those that work internationally, but those that work at home. And I'm on the board of a few of those. And, we're struggling to get personal protective equipment,
Of
ironically,
course.
trying to import it from China, but we're trying to bring it in. And I guess, my question is there something, do you think, about the fact that we are at the top of the food chain in society that makes it
Mhm.
harder for us to prepare for pandemics?
Maybe I think the hubris is right, but I also think that one of the big problems is that we've really developed our systems so to such an advanced level. And this is true just even in medical care, right? We've developed our systems so high and complex that we are not looking holistically. So in our US government system, you can speak to some of the others, but in our US government system, we're very siloed, and we built wonderful, amazing teams for pathogen one, pathogen two, pathogen three, and they were siloed up.
Mm.
And then we said, you agency, you are responsible for this, and this other agency is responsible for that. And we didn't really have a way to bring them all together, which is what One Health and what I've been championing for 2 decades now is really about. It's really about bringing together those disciplines, having a way to convene them rapidly, having a way to have mutual respect and language. You have to do that in the front. You have to do it before these things happen. Many of the countries that we talked about earlier in Predict, they have, because we've been working and doing all of this prep work, they have established One Health platforms, zoonotic disease task forces. They have the people pre-identified to pull together out of all of those sectors that you mentioned, the NGOs, the academics, the ministries, but they have a whole structure set up in advance. They have sampling in the environment, in the animals, in the people. They have it all pre-prepared. We need that. And unfortunately, even though we've been calling for the concern that, again, human nature just had us addressing what we just saw with Ebola, Zika, and had us worrying financially about many other things other than diseases. And it's not until something tragic happens that we respond. But the world is listening. Let's take advantage of it and get this set up now.
I think if there's anything that we have learned from this moment, however long that moment is that pandemics preparation and global health solidarity is more important than ever. It's possibly one of the most important things at the start of the 21st century in such an interconnected world.
Absolutely.
So I wanted to ask you a question, and I know this is going to age us in only that the field is moving so rapidly, and guidance will have
changed. You don't know how old I am.
As I said, the joys of modern technology. We all look like we're on TikTok, right?
Yeah, you can see my wrinkles.
So, face masks.
Yes.
To face mask or not to face mask? That is the question. What does the science say we should be doing?
So I mentioned the Standing Committee of the National Academies, and that committee has been doing a wonderful job. Just in 3 weeks, I think we've responded to 11 task orders already, requests for expert consultation. And many may have seen yesterday that our chair, Harvey Feinberg, sent a letter to the White House in response about face masks. And the evidence is showing that while we absolutely know droplets are the most important transmission source, we also can identify that there's a bit more going on than we had originally thought. So we had originally, and I say we, the scientific community, had originally been much more concerned about surfaces and transmission from surfaces, and that's why the hand washing works. All that still works, but there's some new evidence that droplets, even just micro droplets, when you and I talk to each other, if we were in the same room. So I'm glad you're there and I'm here. But droplets from talking in the air may also be transmitting virus. And so face masks may actually be quite helpful in getting this thing under control. And we need to protect our healthcare workers and our essential workforce that's out there and has to interact with us at the post office, at the grocery store, those heroes keeping us all going. They need the N95 or the masks that really are going to protect them from everything. But the rest of us who are going out now and then can do some extra precautionary measures in addition to the hand washing by covering our faces and making sure that we don't, even if we're trying to stay at a distance, we don't get too close and share air or other things with people talking to us. So it's a good idea if you have a bandana, whatever you have, if you're going out or interacting outside of your household with people, protect yourself. It's an abundance of caution.
Yeah. And we'll have on a Shot in the Arm podcast designs that people who have sewing machines at home can use to help prepare and make their own face masks during this time of isolation. So I know that some of my colleagues in the AIDS field will be rolling my eyes when I ask you this question. But, the early years of the AIDS response does come to mind here. We had nearly 15 years to cope without the emergence of antiretrovirals, the cocktail that brought the end of dying so rapidly from HIV. And I wish I hadn't had to go through that experience, but it marked us all horribly. Positive, whether you're positive or negative. But the point is, we got through this. And so I wanted to just ask you what you think the lessons of AIDS and indeed Ebola and Zika are as we work through this period.
Well, we will get through this, but that doesn't bring solace to the families who lose loved ones, and that's going to happen. For heaven's sakes, we can't let the decades go by that went by with HIV, and we need better information. that we've learned a lot, but we've also not changed our behavior very much, and that's the concern. We've learned that these viruses, HIV from non-human primates, SARS, MERS, this one from bats, possibly through intermediate hosts. We've learned a lot, but we don't change our behavior. And now's the time to really figure that out. I actually am really happy to be the head now of something called the One Health Workforce Next Generation. And that is a consortium trying to change curricula all over the world, especially again outside of our own country. I hope we can do it here too, but I'm funded to do it outside of our own country to bring again that mutual respect across disciplines and cross training for emerging infectious diseases, antimicrobial resistance, these kinds of things. So I think there is enough momentum, but for goodness sakes, technology has accelerated. Let's accelerate ourselves and our thinking as well.
So, Jonna, you are a veterinarian by training, and I
Also
guess
an epidemiologist.
yeah,
Yeah.
and so
Yeah.
it's really interesting, I think, to understand your journey, how you got here
Sure.
to be so heavily involved in global public health. I mean, clearly there is that leap from animals to humans with disease, but what's your journey? What drove you?
Well, I started my journey for veterinary medicine because I wanted to save species. It was really about conservation for me. And my first job after my PhD, and I just like to give a little thank you to those who went before me at UC Davis and created really this One Health program many decades, 50 years before we started saying One Health. They created a program where we trained in epidemiology and public health with human, animal, and environmental experts and mathematicians, frankly, all at the same time. So that's my PhD. I was exposed to human cancer risk, all of that at the same time as animal risk. So I had that training, but I was really applying it using my veterinary background to conservation. And in doing that, I ended up getting into emergency response, which keeps me now, even today, obviously in emergency response, but it was emergency response for oil spills. So I was doing oil spill work. You might remember another one that will date us back to the late 80s, Exxon Valdez. And
Yes.
I helped to build a network of oil spill response for the state of California for wildlife. And while working on those wildlife species, I again was fighting for their conservation, but we were discovering collaboratively in this One Health approach that there were many diseases flowing from land to sea, what we call pathogen pollution. And frankly, we were still in the midst of the height of the AIDS confusion, and we were seeing those same pathogens affecting and killing our patients with HIV AIDS. So it really brought that together to me and say, wow, something needs to be done differently. And we were doing One Health, but we weren't calling it One Health then. But that's where it started for me with emerging pathogens and thinking about the linkages of human and animal health and the environmental drivers for that, like flowing from human populations, growth, expansion in our coastal communities here in California, flowing off and making sea otters sick. Well, sea otters eat sushi. And that's really what I said, oh boy, we've got some big issues to deal with. And it took me in this direction.
It's Thank you for that. It is so interesting. Again, the Bay Area Global Health Alliance mantra of we're all in this together.
Mm-hmm.
I mean, my journey into this was through community service back in London in 1989 with refugees from Eastern Africa settling in London and discovering that mums and their babies were having the same opportunistic infections as the gay boys in the city, and that was for me the terrible aha moment that this truly was a global pandemic. So
Right.
it is again, perhaps it's a feature of this era that yes, we ultimately rely on the clinical science, but there is it's how we all apply it. It's how we all come together to use it. So I ask all of my guests this question. How do you stay optimistic? What grounds you and what drives you?
Um, because I need to fight for change. And if we don't stay optimistic, how can we motivate anybody else to be optimistic? I mean, there's so much to bring us down, but even in our own team, seeing them set aside some of their other very important work, and we can't do that forever, but set aside to really come together and bring their expertise to this problem. It gives them a sense of purpose. It can give us all a sense of purpose. And every single citizen, especially in our Bay Area community, every single citizen can contribute to change here. We need to advocate for having better systematic responses and knowing more. And for science, frankly, science has been an enemy for a few years. That really got me down.
Yeah.
More than this, because this I feel like I can help make a change because people are listening, but for a while it felt like the science was the enemy, and that can't be the case because that got us into this.
Yeah, absolutely. Absolutely. Jonna, another question. I mean, you're very upbeat, very optimistic. But how do we fight compassion fatigue? How do we make sure that we stay focused and upbeat for the future?
Well, that's a big challenge, and we can't underestimate the impacts on our mental health, and the toll this will take on our communities. We know from all the previous devastating, tragic events like this that there will be a lot more depression. We will have PTSD in communities, and it will be worse and longer lasting in the communities hardest hit. It's already showing that in China. And so we need to be ready for that. So our healthcare heroes include the mental health professionals that are going to need to help us get through this. But again, if we can be connected, I think the more that we can use technology. Not all of us have great internet connections, but most all of us have cell phones. We need to figure out how to help people stay connected. People are staying away from their elderly family members for good reason, but those family members need to be able to talk to you. So I know it sounds silly, but call your grandma. It needs to be done. And they need you. You actually need them when I say call your grandma, because they can bring you the wisdom, having lived through a lot more tragedies. But that it's not my area. I don't want to speak out of turn or out of my discipline. I would bring people in that do this for a living, but I do think if we can all be part of the solution, it can help us stay more positive. Otherwise, we can just think about the misery and being locked in and not being able to see friends and family members. So we have to channel that for positive future action.
I ring my parents back in the UK every day. And
Oh, nice.
I say, okay, any fever, any shortness of breath, any coughing? And my mother will say, yes, I have a cough. I've had it for 30 years since your cousin's wedding.
Well, humor is also helpful for keeping this up. Yeah, when people ask me, sometimes I slip into, really, this job sounds important. Well, really, it's a dirty job. It belongs on that podcast or TV show rather than yours, in that we just swab a lot of butts and gross noses of all sorts of species, and including people. And that's really how we do this hard work. But it needs to be done.
Absolutely. So one other thing, Jonna, is there anything that we haven't covered that you think it's important that our subscribers and listeners and viewers understand and know about COVID at this point?
I think let's stop the blame game. Let's use the science, and let's know that we can come together to stop this from happening again. But that's going to take change. That's going to take our recognition that we are inextricably linked with our environment, with animals, with other people, and the foods we eat. and we need to be just thinking more holistically. This is a wake-up call that we're not in our little protected fancy bubbles in the Bay Area. We're connected with the whole world. We need to care about the whole world, and we need to look for these things and support the communities where they will start, like this one in China. And we need to not be pointing fingers, but be global citizens.
And perhaps a final bit of concrete advice for us as we get through this period of isolation and self-distancing. How do you get through your days? And particularly, do you binge watch anything on TV? And if so, what are you watching?
Well, everybody's going to ask. I watched Tiger King.
Oh.
I did. I know it was terrible. It was awful. I cannot recommend it. But I do have we were very early to decide to pull in and shelter in place even before we went on the proverbial lockdown. And we did bring our adult family, my adult children from New York City who are living there early here to live with us. And, the millennials got me onto Tiger King. And wow, I see why it drug people in, but yuck. Okay, so that happened. And the rest of what I'm primarily binge watching is stuff on COVID, because I'm trying to be a resource. So stepping away from the nonsense. I'm spending a lot of hours doing this.
Well, I hate to come back to it. We watched Tiger King in one night. Absolutely gripped and horrified. What a train wreck. But there is an issue here about the way we interact with exotic species and our relationship to wildlife, that perhaps, I don't know, maybe there's something there for season 2. I don't know.
Nice segue there. Nice little link. Yeah. So, it is about conservation. And none of those people are about conservation. Oh, none of them.
No, none of them. Absolutely not. Oh, so what's your favorite food? What are you eating at the moment?
Okay, well, my daughter from New York City is also kind of a gourmet chef. So I am putting on pandemic pounds because she is making the most beautiful, herb stuffed chickens with smashed potatoes. She watches Ina Garten and is making everything. So she made me, beautiful ragu with gluten-free pasta because I have other diseases. So I'm really eating well in this pandemic. And that is something that many of our Bay Area community can't say that they're doing. So I feel so blessed, and I'm really concerned. I'm super supportive of the restaurateurs and chefs who are turning their kitchens into to develop and give food out to the communities, because this financial crisis is going to hit parts of our community so much harder than others, and we all need to do what we can and be in it together on that front as well.
Yeah, and indeed some of our local community members, and I'm thinking of the California Prevention and Education Project, they've been out in Oakland finding the food banks, advertising them on Facebook, live streaming them, getting onto to YouTube, telling people where the resources are. It's really bringing us together, I think, in an incredible way.
And the essential workers too, even in our lab, that are helping with the labs all around the country. So they have to go to work, can't be sheltering and being more careful. And we're trying to figure out how to keep them fed well and safely so that they don't have to go out and in and out and in. And, it's a big challenge, but we can do it. We can.
And what an interesting group of frontline workers and heroes from all over society are helping us through this. Yeah. Well, Jonna, please keep up the good work. Stay safe and strong. Thank you so much for being on the show. You are a shot in the arm.
Thank you. Well, you give me one, so I appreciate it. Keep doing it.
Well, that's it for this episode. Thanks again to Jonna Mazet from UC Davis and to Sarah Anderson from the Bay Area Global Health Alliance. We hope you found the show useful and informative. As always, we would love to know your thoughts on the subject we have covered and issues you think we ought to address. please contact us through the usual social networks, including Twitter and Facebook, at Shot Arm Podcast. Our thanks to our producer and director, Eric Aspera of Newsdoc Media, who makes the magic happen. This episode, I'm thinking of Shire horses. They are a British breed of incredibly strong, powerful and tall horses, and they remind me of the fearless and tireless leaders who have been at the forefront of our response to infectious disease for over 30 years, and who are again taking to the front lines, and who again inspire us in these dark times. So whether in the Bay Area, Toronto, London, Johannesburg or Phnom Penh, stay strong and resilient, my friends. And finally, thanks to you for joining us, and have a great week and have a safe week, everyone.